Okay, here's one more question. I'm going to take this one, and you guys can add in because it's a medical and clinical problem. My daughter purges pretty much every meal, but she also has a drinking problem. Which one should she get help for first, and can it be done simultaneously? As we discussed the holidays with all our overeating, we'll throw this one in there as well. This is one of the things we do when somebody calls is we do a very thorough screening to make sure that we can help the person. And this is one of the things we look at screening. Generally, I think that they can be treated together, but sometimes the eating disorders require more of an intense medical management than we do here. Our primary focus is substance use. There are places who their primary focus are eating disorders. And, sometimes we try to figure out that beforehand, but not always. Sometimes when someone's in treatment, we'll see what's prominent and then go from there and say, well, I think you need to go work on your eating disorder first and then come back. Which caused the greatest harm immediately? The greatest immediate harm is what we'd be looking at, and it would have to do with, how much drinking are you restricting, or also along with your purging. If you're eating one apple a day and purging that, then probably we need to get you to deal with your eating disorder first. But it's they do tend to go hand in hand. The other thing, sometimes people use stimulants to suppress their appetite. And so it could be just a primary eating disorder, and then they found that, wow, methamphetamine works really well to make me not want to eat. Yeah. So then they end up with a drug problem and an eating disorder. And one doesn't go away just because you treat the other. You have to treat them. You have to treat them both, and the order is up for grabs.